Hi guys. Uh, we're going to move on to chapter 6, and this one is musculoskeletal. And I apologize ahead of time. I have a cold. I don't know what's going on, and so I can hear myself talking. So hopefully I still am coming across okay. So I am going to share my screen here. And we'll get started on musculoskeletal. This one has, I think, 34 slides. It's not too bad. Should be able to get through it relatively quickly. So when you think about the musculoskeletal system, you think about the muscles, joints, bones, all of those things kind of fall into the musculoskeletal system. The bones is what provide the framework and support for your body. They're classified by shape and composition. Your joints is just classified as where two or more bones meet. And then your muscle structure, movement, and heat all are part of anatomy and physiology. Different kinds of diseases. There's bone and joint diseases that cause deformity, decreased mobility, pain, swelling. And then there's muscle disorders that can cause weakness, swelling, all sorts of different things. There's different tests that we use for diagnosing problems with the musculoskeletal system, CAT scans, MRIs. BMD is just bone mass density. That's just testing to see how dense our bones are. If the less dense they are, the more weak that they are, with such things like osteoporosis. They're going to do blood studies looking at calcium and phosphorus. That has to do with bone density again. Our bones are made up of lots of things, but calcium being one of them. There are ultrasounds, electromyography. There's different diseases of the bones that can vary from mild to severe, more common as we age, of course. There's different spinal deformities, kyphosis. I have seen this. I've never seen lordosis. And of course, I have seen scoliosis. I don't know if anybody in here has had that. But kyphosis is just a curvature of the thoracic spine. They actually are talking a little bit more about how youth are getting this it's not the thoracic spine so much, but that cervical spine in their neck. They have a hump there because their necks are always bent over. It's interesting. Lordosis is just an exaggerated inward curve of your spine. And then scoliosis is that lateral curvature of the spine. And all of these can range on mild to severe. And then here you go with scoliosis. Scoliosis, kyphosis, lordosis. So interesting to me how the spine can maneuver itself in different ways. So there's different diseases of the bone. Osteoporosis is the bone disease that cause our bones to be more porous and leads to decrease in the bone mass. So there's more holes in our bones, and you don't want that. You want your bones to be strong, and you don't want them to have holes in them for sure. Osteomyelitis is an inflammation of the bone caused by staph, and that's the most common cause according to the text. And then osteomalacia is just a softening of the bones. This can be due to rickets or a vitamin B deficiency. When you have diseases of the joints, most of them occur as a slow process. If you think about it, diseases of the bones and the joints aren't going to happen overnight typically. Think about arthritis. Typically that's something that happens in older adults, and it's due to inflammation in our joints, and inflammation is swelling of those joints, and that's why they give them anti-inflammatories. For arthritis, osteoarthritis is a degenerative process, or what we call wearing out of the joint. We talked a little bit about rheumatoid arthritis in the last chapter, but this is again an autoimmune disorder that affects the joints and the connective tissue. Just think about those fingers of the people that have rheumatoid arthritis. You will see this. If you haven't seen it already in one of your family members or a friend, family friend, you will see this at some point in your career. Rheumatoid versus osteoarthritis. Osteoarthritis affects working joints, and rheumatoid arthritis can affect every joint. So just remember that. That's not, I don't think, anything on your exam, but that's just an easy way to remember it. Gout is a metabolic error in the breakdown of certain proteins, foods. A lot of people consider this in people who eat high protein diets, low carb kind of things. It can also be, from what I understand, it can be a hereditary kind of thing. Parents who have gout, their kids can be more likely to get gout. I think that it's more associated with people who have other things going on, but there are treatments for gout, but usually gout occurs in a big toe. That's the first place that people are going to notice it. This is a gout diet plan. These are things that they should be eating. Of course, any kind of pyramid, the bottom is what the main portion of what they should be eating: vegetables and fruits, beans, pastas, whole grains. It's obviously not a low carb diet. Healthy fats, fish and seafood, but you see up there that there is other sources of protein, but you don't see a lot. Poultry and lean meats. There is not a lot of like steak, hamburger, like none of that really, because that's what contributes to the gout. And it can be very painful, from what I understand. I don't have this, but I have been told that it is very, very painful. And it has to do with uric acid and a buildup of that. And somehow it all ends up in that big toe and causes them severe pain. All right. On this slide, I think probably the only thing that you need to know is TMJ. This has to do with that temporomandibular joint. This can cause severe headaches and pain in the jaw. I don't know if any of you guys have ever heard of TMJ, but it's sometimes a popping in that jaw bone when people will open their mouth. Their jaw will pop and it will actually hurt them. And so they will have severe pain in their jaw, which can lead to headaches. Muscular dystrophy is an inherited genetic disorder that affects the skeletal muscles. And this is something that can affect families, and it's very devastating. Has been called Duchenne's muscular dystrophy. I have seen a whole family of 4 children pass away of this. All children did because both parents had that gene, and all of their children got that gene. Now, they were older. I think their youngest one that passed away at the age of maybe like 17, but the other 2 had graduated, 2 or 3 had graduated high school. So they do, their life expectancy is less, but they do live past infancy. A ganglion cyst is just a fluid-filled benign tumor near the wrist. These are, years ago, they used to associate this with Bibles and tell people to smack them with a Bible, but now they'll go in and sometimes either drain the fluid or just take it out. Tetanus, we don't see a whole lot. I've never seen this. This is also known as lockjaw. It's a life-threatening illness, disease. People used to die from this before we had vaccines. And but now most people get a tetanus shot every 5 to 10 years. And but my great-great-grandmother died from tetanus in the early 1900s. All right, neoplasms. There are we're going to talk about this a little bit later in the cancer chapter, later on in the book, but primary neoplasms of the musculoskeletal system are uncommon. They're typically secondary, metastasizing from the lungs, breast, or prostate. So the best way that I can tell you, and again, we'll talk about this later in the cancer chapter, but the best way I can tell you to understand metastasizing or primary and secondary is that when let's say someone has breast cancer and they also have cancer in their pancreas or their lymph nodes or their brain, and how do they know where that cancer came from or started? And so the way that they can figure that out is if they take a piece of the tumor and it will show parts of that tissue from where it came from. And so that's how they will say, you have breast cancer that has metastasized to your lymph nodes and your bone and your brain. But they know that it started in the breast because that's where they will have pieces of that originating tissue in the other cancer areas. Osteosarcoma is the most common primary tumor or bone. Rhabdomyosarcoma is a very rare, highly malignant tumor of skeletal muscle. I've never seen this. This isn't something you guys need to know about. The main cause of problems in the musculoskeletal system, fractures, which is a break in the bone. I don't think there's anything on your exam about the types of fractures, but I wanted to put them on here just so that you guys would have a basic understanding of them. I don't know. I know even as a nurse and a nurse practitioner nowadays, I don't know about all of these. I've never seen some of these. I've never seen an impacted fracture. I've never seen an oblique fracture. There's several, but the most common ones that you're going to see, a lot of people will get stress fractures. So open fracture versus closed. An open fracture just means it broke the skin. And complete or incomplete green stick. A green stick fracture mainly occurs in children. You might see a compression fracture. I'm sure some of you have had fractures over your lifetime or had kids that have had them. Here's a visual for you guys who are visual learners. These are different types of fractures. A transverse fracture is a complete, and the break occurs at the right angle to the axis of the bone. That's the way I believe most fractures are. Spiral fracture is caused by twisting a bone excessively. This is seen a lot in children, and usually, not always, but usually there's a concern about child abuse when you see spiral fractures in children. To treat them, you guys probably already know this, you're going to immobilize the bone. They're going to put it in traction if they need to. There is open and closed reduction. Strains and sprains. Strain is just an overstretching of that injury of the muscle. They're going to rest, moist heat, pain medications, and anti-inflammatories. Sprain is an injury to that joint. So this one is an overstretching injury. This one is just traumatic injury. Treatment is always the acronym is RICE, rest, ice, compression, and elevation. And it does work for treatment of strains, also of strains. Dislocation would be a complete separation of that bone from the normal position. It does cause a lot of pain and joint deformity. You don't need to know what subluxation is. Again, this is just a picture of a dislocation. Low back pain is a very common disorder, maybe acute or chronic. There are different treatments for this. This is very, very common. I don't know if there are many people 40-ish and up who haven't had low back pain in their lifetime. They're going to treat it with heat, analgesics for pain, anti-inflammatories, and muscle relaxers. It can be very, very painful though. I have had low back pain and it is horrible and you feel miserable. It makes you feel very old, or at least makes me feel very old. Herniated discs. I don't know how much you guys need to know about this other than to know that, and this is what I can tell you about all of this. So when you're talking low back pain, herniated disc, slip disc, bulging disc, a lot of your clients are going to say that they have low back pain because you can look on an MRI, you can look on an X-ray, but low back pain is really, really something that is subjective that they can't really measure. And so a lot of our clients, not all, but a lot, will say that they have some form of back pain, and maybe many of them do. But there are some of those clients out there who will use that because they know that nobody can measure that necessarily. And that's why if you ever have went into the ER with low back pain, you'll realize very quickly that they tend to have a jaded, not all ERs, but some have a jaded experience with that because they have so many people who use that to try to get pain pills. All right, so treatment for herniated disc, ruptured disc, slip disc, bulging disc. It's going to cause pressure on the spinal nerve, pain, and it's going to be the treatment same as low back pain. A lot of our clients will use chiropractors, and that's okay. Bursitis is just inflammation of the bursa, or the small fluid-filled sac near the joints, and this can be painful, can cause severe pain and limit their motion of that joint because of the pain. You're going to want to have them use moist heat, pain relievers, anti-inflammatory agents, because again, taking down that inflammation will help that joint move a little bit better and not be so painful. Tendinitis is just inflammation again of the tendon, the connective tissue that attaches that muscle to the bone, and it can occur in any tendon. Again, same kind of thing, ice, medications for pain, medications to take down inflammation. They're going to give them specific exercises, and they may end up having to do surgery for this one. Carpal tunnel syndrome is a repetitive motion. This affects your hands and gets worse at night, typically, from what I understand. And this affects people who do repetitive tasks, such as typing. Factory workers can get this. And usually they'll say, one of the classic symptoms that I've heard them say is, I wake up at night, in the middle of the night, and they have this horrible pain in their wrists and their hands. They're going to do rest, splints, anti-inflammatories, physical therapy, and surgery is really the only thing that will correct this and cure this. Plantar fasciitis. I did not have a lot of dealings with plantar fasciitis until my husband got this about a year ago now. And he said that it felt like he was walking on rocks all the time and was very, very painful. And that he got shoe inserts and did anti-inflammatories. But really what just helped him the most was rest. And he did do ice. My mother also had this. Be interesting to know if any of you guys have had any family members or yourself who have had this. There's your plantar fascia. All right. Shoulder and knee disorders. You can have a torn rotator cuff, torn meniscus, and ligament tears. So all of these things that are on this slide can happen to anyone. Usually these happen to people who are really active, or to people who are not active and become active. And so and usually for things, especially when you see things are like torn, blah, 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 ligament tear, those are usually going to require surgery to repair. Shin splints, this is an overuse injury to the periosteum and the extensor muscle of the lower leg. This occurs routinely with sudden increase in activity. So let me give you an example of this. So this happens a lot in basic training of military. So when people come into basic training and they haven't been running, and then all of a sudden they're running nonstop, they tend to get shin splints, and they're very painful. Again, rest, pain management, taking care of the inflammation, and heat and ice. Very hard to do when you're in basic training. All right, so one of the last few slides, maybe the last one it is. Decreased bone density, that happens as we age, especially for women, but can happen in men also. So they'll do those bone density exams where they're going to check and see how dense your bones are, see if you need to take supplements. Decreased muscle strength and mass as we age. Our muscles just decrease, although I don't know if any of you watch some of those YouTube videos, or I think maybe it was There was one on America's Got Talent. There was one I saw on YouTube of a lady who had been a dancer her whole life and a gymnast, and she was doing this bar routine, and she was in her 90s. I don't know if any of you guys saw that, but she was pretty amazing. And then there was one on America's Got Talent of two older men who, you know, did these gymnastic looking things, and they were pretty amazing too. All right, if you guys have any questions about musculoskeletal, let me know, and that includes bones. Let me know, and I will try to answer those the best I can. And then we will pick up with chapter 7 next.